This call is now being recorded.
Dr. Mehta, I would like to ask you about a case you encountered in the mid-1970s during your tenure in Indore. Please tell us about this interesting case.
Yeah. Now, while working at Indore, I was asked to come and see a boy aged 14 years in 1977. The boy had a generalized arthritis, all joints, big and small, excluding the temporomandibular joint, and they were swollen and a reddish swollen and very painful to touch even. No movement was possible, and rest of the systemic examination did not reveal involvement of any serous membrane or hepatitis, spleen, and rest there was only a raised ESR.
Did you think of rheumatic fever or?
Because of the involvement of joints, big and small, and multiple joints, it did not come in the picture.
All right. So the patient did not have systemic toxemia and no source, organ involvement, or indication on the lab work of a systemic disease. What was your conclusion?
And RA factor was positive.
I see.
So with that, my diagnosis is a case of arthritis in a young person known as juvenile rheumatoid arthritis.
All right. So interesting case.
With the permission of the parents to use steroids to produce a remission, I started steroid therapy, and within 15 days, there was a remarkable improvement, and he started sitting, walking with support, and he appeared quite comfortable. The reduced erythema and reduced swelling and pain.
So overall, he had a modest improvement with the use of oral corticosteroids within weeks.
Yeah.
So how did you manage him thereafter?
So then only drug that was available for immunosuppression was gold injection of myocrystin, which was a gold preparation, sodium.
Yeah, so you're talking of gold, using gold, which probably was the first DMARD, disease-modifying anti-rheumatic drug, available since the 1920s and had become virtually extinct in its usage by the 1970s, and you decided to use gold therapy.
With the advent of the biological TMRA DS.
The biologicals were not available at that time in the 1970s, so gold was the only choice at that time. And so what happened?
At the end of 1 year, he went in complete remission, was able to join back his school, he could play games, and he completed his studies. And my subsequent communication with him that he did not have any joint pains later. Now he is a father of 2 children working in United States, and to my utter surprise, he never had anything so far.
So he has had no recurrence ever since his childhood.
Yeah.
After he completed he was probably treated for several months on golds, you think, as a DMARD?
Yeah, he was. My previous experience was with adult rheumatoid arthritis, but they never got such a complete remission.
So it seems myocrystin or sodium orothiomycin injection, which is a gold compound licensed for use in rheumatoid arthritis, was more effective in this juvenile case compared to your prior experience of use in the adults.
Yeah.
Interesting. Incidentally, myocrystin is no longer available. The manufacturer discontinued its production in July of 2019 because of lack of availability of the raw components.
The boy was lucky. There were no side effects at all.
That's wonderful. Yeah. And he's doing well. Yeah. So this kind of illustrates a case managed with the ancient DMARD very successfully with no recurrence whatsoever.
And no limb growth also. Huh? He became quite tall.
Yeah. Although the joints were affected, the metaphysis was not chronically injured, so it didn't affect his height at all.
He grew into a man with a height of 6 feet 2 inches.
Yeah.
And excellent health.
That's amazing. Okay.